cloud. Okay. So again, welcome everyone. And as Renee said, it's really exciting to see the amount of people that are getting, like having that interest of volunteering in a time where it's really hard because of the restrictions in volunteering, but also because of the amount of need that there is out in all our communities. Stride is a program that has presence, provincial presence, and how it looks and how do we work with that provincial presence will be like explained, and we'll talk a little bit about that. We have a team today here that to provide this orientation. So we have Idara, Ivana, and I, and Renee. Megan is there as well. So please, we have an idea of how the flow is going to go, but we're really flexible and we always try to support each other. So if I'm missing anything, or if you want to jump and because there's something that you want to add, please feel free to do it. And that's how we work. We're not interrupting each other. That's how we work. And I am really happy that we can contribute to each other and support each other in this kind of processes as well. So when I think about Stride, and I want to share a little bit of a story of one of the advocacy cases that I'm working with right now. So we're working with an Indigenous person up north, and it's being a case in which the reality of colonization has been really, really loud. Like, you could see the reality of colonization usually through every single case that we work with, but in this case has been so present. Is that we're talking about an Indigenous person who the story, the individual story of this person has been intersected for so much by so much discrimination and the push out of their own land into reserves and enforced poverty and enforced violence. And so working in supporting this person and unpeeling each one of the layers of the case have been really revealing of the importance of being mindful of where we're at and the history of the place where we live in. So every one of the places that you mentioned that you're located in, and where the Young Humphrey Center works from, the Amaskwaciyoskahegin, is a place that is originally Indigenous land that has been built on their land. And to do that, we as a society have forced Indigenous communities out of this land. We have changed the way people relate to this land, and we now act over this land and over these relationships in ways that create marginalization and discrimination. And so in doing advocacy with that in mind is really important, because it allows us to see all the complexities of the advocacy that we're working with, but also in thinking what is just and how to bring justice to this place. And so for us, acknowledging that we are located in Amaskwaciyoskahegin, that we are part of a treaty signed hundreds of years ago, that brings a responsibility to us. And so recognizing is not only recognizing the treaty, is recognizing that we are immersed on those social relations and that we have a responsibility, historical responsibility at this point in time. Whether we were born here or not, we accept this responsibility as being part of this society. So that is the framework that we work in, and we strive to do that and call us on that all the time. So next slide, Idara. And so Stride was born a few years ago. I'm just going to tell you a little bit of the story, primarily to kind of connect all these logos and agencies that you are seeing in this slide into the work of Stride. So Stride came to be in about 3 years ago in 2017, when we heard from the community that they wanted some information sessions about different things. And among those things were like healthcare and housing and needs that they had, and organizations that they have tried to access, or resources they have tried to access, but they have been unsuccessful in doing so. So we were starting to connect these, the providers of these services with community members and create these information sessions. And they were really successful in empowering some people to actually work towards finding ways to access these services. But in so many ways, those information sessions also showed us that in many cases, people do not access the services, one, because they don't feel that they know the process enough to do it, two, because they have had experiences of discrimination within those organizations, three, because they need other supports. Perhaps it's language support, perhaps it's someone who writes a letter for them, perhaps it's something that more practical. And so we have been working on these 3 years on how to support that people, those community members, through community-based advocates. So instead of we or creating an agency that can do that for them, is rather how do we train community members and support community members in providing those supports that their own community members have and need, because that's happening. So when I go to my friends and say, please help me fill out this form, that is already a way of support. So we're trying to train these people that are available to provide that one-on-one support to others with enough information, but also with enough access to where the information is at and connections, so they can provide a more effective support to their community members. And in doing so, many organizations, we have started to create connections with many organizations that we trust, many organizations that have similar ways of working with people, and that are allowing us these connections with these partnerships with these organizations are allowing us to create a model of advocacy in which we put the person that we are supporting at the center, and we create a team around them to see how we can support their case, their individual case, but also how to use the connections in these organizations to be effective in what we are doing, and doing the most compassionate, effective, and mindful way. So all these organizations that you see in these slides are organizations that we have partnerships with to do this work. And so through some of them we receive cases, with some of them we share cases, with some of them we do referrals. So, but as you see, it's a network of organizations, but it's also a network of community advocates that are supporting, that started by, and you will see a little bit farther ahead in the presentation how Stride has also evolved from there, but that was the original intent. And all these partnerships have been created with that in mind. Next slide. And so our goal, and a couple of years ago, some of those community-based advocates met, and we have a regional gathering, and this is how they describe the goal. So our goal as advocates is to document human rights related concerns and ensure that community members have a space where they feel heard, are believed, and are not alone. And one of them, I just want to call our attention on the fact that when we have, we're facing discrimination, or where we, when we want to access resources, usually there is a lot of pressure on the person that is not only feel discriminated, but also has to either prove it or do something about it. And that's a lot of pressure. That's like an added layer. So having that network of support and making this person feel heard and believed and not alone is fundamental in the process of advocacy. So we work to create a safety net for the community and act as a space for people to be heard and identify their desired outcomes. We always work with the desired outcome of the person or the community in mind. That's what moved us. We might have ideas and individual impressions of what to do and how to do it, but it is the guidance of the person who needs the support what actually guide the process. So that is also fundamental. And advocates work for the people and seek not to be the voice of community, but to amplify the voice and walk alongside. So this quote and this description is really meaningful to us, because that's how we guide the process that we have in all the different spaces that Stride is working in it right now.
Okay, so there are different forms of Stride advocacy. well, there's four main forms of stride advocacy, or of advocacy, I should say. So we have the stride advocacy that mostly has to do with taking in cases, so human rights complaints or individuals who are in need, and kind of like documenting, doing some research, and kind of like assisting that community member to get the outcome, the best possible outcome, or the outcome that they are, I guess, hoping for. We have Street Stride, that is actually volunteers and individuals who go out, so who are kind of like go out into the streets and like promote feelings of dignity in community members, engage in conversation with people in order to just provide kind of like connection, and they focus mainly with the on-house population in the city. So that's like a face-to-face interaction. We also have Social Stride, and that is an online form of advocacy that targets kind of like bullying, discrimination, racism online, because we all know that that is an issue. And that is something that we are continuing to develop. Another huge aspect of that is countering misinformation, because there is so much information accessible online. So we try to make sure what we have is accurate, and people get the the truest forms of information. We also have the YEG community response that supports people with with things that they might need in times of emergency. It's more of an emergency response. So for example, we have the COVID response Facebook page, where we get sort of like requests for people, or if people want to make donations or that kind of stuff. And then we have a group that kind of manages that page and connects individuals with, whether it's like required resources. And it's really also great because that brings the community together. And we have found that a lot of it kind of like runs itself a little bit with community members like jumping in to help each other, which is really great to see. So those are the kind of like four main forms of advocacy. And of course, there are other they are all interconnected as well.
Ivana?
Yes. So the way people connect with us, so for many times it's for cases or anything that they kind of need support with, is through Facebook. So we have that YEG community response Facebook group. And a lot of the time we get cases come in through there where we see persistent need in the communities, and we put them into cases, and Stride Advocacy will help with that. And then we have calls that come into the John Humphrey Center. Some people connect through our different partner organizations as well, through the Stride webpage and the Coalition webpage is mostly where we get many of our cases. But we also have people coming in-person contact, just telling us about their cases. Especially, we found that a lot in our training sessions when we were educating. And then through email, we get a lot of emails with the cases as well. So the way we connect, when we're reaching out to the community members that need support, we generally use MightyCall. And I know for a lot of the cases that I've been in charge of, not in charge of, but managing, we've used MightyCall. And the way it works is it protects the advocate's privacy. So you call from a specific number, and let me focus. You call, you program the number into your phone. It's just an app, or you can call using your computer as well. And it'll call saying it's John Humphrey Center calling. And so that way our advocates don't have to give out their personal information. Because we have had issues in the past where an advocate might call and then they'll get called back at inappropriate times or things like that. So it's just, we've been using that, and that's been okay. I think we're still working through how to use MightyCall 100%. But we can also, we can also text through the app as well. We have the ability to use Zoom for meetings, for intake calls, in person. In person's a little different right now, but still our Street Stride folks are going out there and helping and supporting the community in person and through email. Email is a very big part of the work we're doing right now. It's how we communicate with the cases, and yeah, I think didn't miss anything, did I? Other than what Renee's putting there.
Yeah, I think Renee is just mentioning that just last night we were talking about starting to use other applications when they're urgent response. That we used to host clinics. So we went to communities and bring a group of advocates that will get cases right on the spot. But obviously due to COVID and the restrictions, we're not able to do that. However, there are emergencies, and how do we deal with that emergencies? Some of the things that we are trying to deal with right now, and how when for example, someone is on the streets and their rights have been violated by, or there is a discrimination case right there, and the person there is no way to call that person back. So we're going to try to implement the Signal application. So we call a group of people that are usually available to do an intake right there. But that's something that is starting to happen. So those complex cases are going to be in the developing. Stride is always developing. And so that's a new thing that is happening. Yes, go ahead.
Okay, so this really, I guess, complicated looking like picture here just shows the volunteer structure. And I'll do a little bit of explaining here. So like I mentioned earlier, we have 4 forms of advocacy: that's social stride, community response, stride advocacy, and street stride. And with all of these different aspects, we have volunteers who kind of like wrap around it to make it what it is and to help support it. So we have the volunteer management team, which I guess is the whole John Humphrey Center team. And I'm the volunteer coordinator. So I would usually do all the postings and recruitment and connect with interested volunteers. So for example, the Street Stride team, we have volunteers who go out, like I mentioned, like during the day or on the streets, I guess, or in the evenings, and they connect with individuals, help hand out necessary, I guess, like things such as like food and clothing that are needed depending on the weather. And that's actually, we have volunteers who go out for Street Stride. We have Mondays, Wednesdays, and Fridays from about 9 a.m. to about like 1 p.m. And then and that's on the downtown location. And then we recently expanded to Alberta Ave, which is, I believe, on Wednesdays and Sundays from 6 p.m. to 9 p.m. So Monday, Wednesdays, Fridays from 9 a.m. to 1 p.m. and Wednesdays and Sundays from 6 to 9 p.m. And volunteers go out. Volunteers don't go out on their own. They go out with our community organizer, Judy, and a group of other volunteers, and kind of like just interact with people. For Stride Advocacy, we have a group of community advocates, which I guess is a lot of the volunteers actually on this call. So they interact with individuals like over, email, MightyCall, telephone, Zoom, that kind of thing, to do intake processes, to help with research, and all of that, I guess, fun stuff. Then we have the case managers who actually oversee the cases and assign community advocates, so 2 community advocates to a case. We also have the debrief and resource volunteers, which are actually members of various organizations that partner with JHC, and they assist with connecting individuals and community advocates with necessary resources depending on the case. We also have the community response. That's another form of advocacy, and we have volunteers for that. Like I mentioned earlier, there's the Facebook page where we have a lot of community members that post like things that they need or things that they're doing or things they have for donation, and we have a group that wraps around that and connects individuals. We also have the food pantry that's open on Mondays. And we have volunteers who help with organization of that, taking down of information, assisting with at the actual like location of the pantry, as well as kind of directing traffic to make sure that people are like social distancing and kind of like adhering to all of the procedures that are needed in this time. And we actually, for the food pantry, we actually do need more volunteers for that. And that takes place on Monday from about 2 p.m. to 6 p.m. There is a location. I think it's a little bit on the north side. So if you are interested in that, please connect with me and I'll give you more information about that. And we also have social stride, like I mentioned, that is to target kind of like online hate and discrimination and bullying and misinformation. And we're starting to kind of, or we will soon start to kind of build volunteer advocates around that as well. And like I mentioned, everything kind of like is interconnected. So with the YEG community response, we could get some individuals who need further help, and we can kind of refer them to the Stride advocacy position, or the Stride advocacy form of advocacy, I guess, and connect them with community advocates that help them get their desired outcomes. Yeah. So that's kind of like what this diagram's saying here.
Yeah, and I think one of the things that in the previous graphic that it's important is that each one of the advocacy spaces, like Street Stride or Stride Advocate, they have different tasks and different needs around it. So depending on your schedule, depending on your desire, depending on what area do you want to be. So do you want to be more supporting the streets work, which is more face-to-face and providing coffee, hearing people, collecting, perhaps doing an intake or two out on the streets if there is an emergency. But it's a different kind of a space at a Stride Advocacy, where we're connecting with people. Stride Advocacy, we're connecting with people through the application, through the app, on the phone, doing intakes, and kind of like Ivan is going to talk a little bit more about the process, because it's the advocacy space that kind of like it's bigger and more developed and needs more continuous support right now. And we have the YEG community response, which is more immediate need. You will be involved on the page, responding to posts, looking for ISOs, and being at the pantry, loading and loading. So depending on where you are at and what your schedule is and your desire is, so those are different spaces that you can explore.
Ivana?
So for Stride Advocacy, the way it usually works is that we'll get a community member reach out to us, and then a case manager will be assigned, and we will look for some volunteers. So based on what the community member has said in the first contact point, so whether they say it's something to do with discrimination, employment, something like that, there's a large array, and I'm sure you guys have done, most of you guys have done the volunteer assessment, I think is what it's called. Mm-hmm. And there we asked about the different areas that you know about. So depending on what the case is calling for, what the specific community member says that they need support with, we'll reach out to the advocates who have said that they know something about that area. We send out an email to just a whole bunch of advocates. And then from there, when we look at who's replying, kind of what they feel comfortable with, because we definitely want one advocate that feels comfortable conducting the interview. And then we want one advocate that feels comfortable documenting it, because documentation is so important in that intake process. So what we'll do is, once we have the two advocates ready, we'll send you an email with the procedure. So how to set up MightyCall, how to call them from MightyCall, send the community member an email asking what time works for them, between what times it works for both advocates. And then once we have that, you guys will do the call, or the Stride advocates will do the call with the community member. They'll do the intake. We have the specific questions already set out for you as part of the notes we share when we give you all the information on the case. And those questions are really just taken out of the Alberta Human Rights Complaint form. So they're really set to, one, help us get a good understanding of what the case is, what's happening in the case. And then another thing is that they're already the questions that we would have to answer on the form. So if we do go ahead and do a human rights complaint, an Alberta human rights complaint, then we already have all the answers right there. So once that's done, you share the notes with the case manager, wherever your case manager may be. And then from there, we set up a debrief call. So the case manager needs a chance to look over the notes to see kind of, okay, what area is it? Because a lot of times people will say it's an employment thing and then it ends up being something else. We want to see who we can bring in to that debrief call to support as a resource and debriefer. And then from there, we have a debrief call and we decide how to go ahead with this case. So a lot of the times that can include writing letters, drafting complaints, sometimes even doing research, connecting to resources and agencies. So it just depends on the case and what the person's specifically looking for. A lot of the times we might think that they can do an Alberta human rights complaint or they can do something, but that's not really what their goal is. So I know, and I haven't had a case like this particularly, but I know maybe Renee can speak to that. There's been times where it's just a ceremony that they're looking to have to kind of help them resolve it more internally and things like that. But definitely the cases that I've helped with, we've done Alberta human rights complaints, so we've done quite a few of those. So it's really just filling out the complaint, and we help the community members fill out the complaint by just gathering the notes that we have from the intake and any other documentation that they've sent to us to get a better idea. And we help write it because a lot of the times community members don't feel prepared to write this themselves. It can be re-traumatizing to have to put it into words. It can be a little bit, it can be difficult to talk about your own experiences kind of in like a black and white kind of way. So that's why we help and we support with that. But the way it works is we draft either a letter or a complaint for them and we send it to them so they can review and make any changes if they see fit. We don't ever send, or generally we don't send the complaints from ourselves. If we don't send it ourselves, we'll send it to the community member who needs the support and they will decide what to do if they want to go ahead with the complaint or not. That is completely up to them. I have another case right now where she has quite a long legal battle. She's had quite a long legal battle. And what we're looking for right now is a lawyer who can support. So one of the advocates went through probably like, this is a lot. I haven't had a case like this before, but it was about 300 pages worth of just lawyer notes. And she went through and made a quick debrief for a lawyer so we can send that out to lawyers and see who's willing to support her on this. So we have things like that. We've written letters to MPs and other people. There was one, I think it was like a chain store that we had to write a letter for as well. So there's quite a lot of different things. We have some advocates doing research for some seniors treatments that's going on down in Slave Lake. So we have a bunch of different things that our advocates really help with, just depending on the case. So yeah, I don't know if there's anything that anybody wants to add. But.
Okay, no.
Okay, so like we said, strategy is always kind of like evolving and growing. Another aspect to it is facilitating and organizing. That's another thing that the advocates do. So we have advocates who work with community members on more kind of like systemic issues or more systemic areas. And then, just to ensure that everything is, respectful and collaborative. And a few of the things that we are working on, for the issues I would say we're working on are listed below. So we have senior care facilities. I think Ivana had mentioned that there are people who actually advocates who assist with that. We have home care, so housing, shelters, policing, prisons as well. And also Renee just mentioned child welfare as well. So these are more kind of like, I guess, larger scale, more systemic issues that we also have advocates work with. So they're working with the debrief and resource volunteers who may specialize in these areas and know a little bit more about it, and then working to connect individuals, community members to the necessary resources that are available. And there's like a note here that says we're not ready for volunteers in this area, but if you are interested, because I know that I did send out, like the advocate assessment form that has, you know, it has, I guess, a question that asks about like strong suits or what advocates or what individuals know more about. So if this is something that you're interested in, or if any of this kind of areas or something you want to learn more about, please connect with me. And when we do start like heavier recruiting for that, I will be in touch. Yeah, I don't know if anybody wanted to add anything.
I just want to add, thank you, Dara. I just want to add that in this, how the systemic cases come to be, is usually we receive one case of something, of one person, but then in working with that case, many organizations or many people, or we realize that it goes beyond this one person. It goes beyond this case. And so, for example, in Slave Lake, what happened is that we were called to do a few intakes about the health system and discussing what was happening there with the health system. When we went up there were people ready to, there were 48 people ready to do human rights complaints about the health system there. And so we go from, let's go to discuss what's happening with the health system up there, to like, oh my God, we have a repetitive situation in the case of all these individual people. So how do we address it systemically? How do we understand that it's not only the experience of one person that is being discriminated against, but the experience of all this community that is being left behind from the health system? And so we did two kinds of complaints processes. One, the internal complaint process with the AHS, Alberta Health Care, and then with the commission, with the Alberta Human Rights Commission. And the idea was to file individual cases that show the systemic issue, but at the same time, many other systemic issues have appeared around that healthcare system, the lack of access to healthcare up north. So it's about how this one case becomes, oh, it goes beyond that. It's not one person that is affected. And with the child welfare is, it's a continuous thing. Right now we're working, trying to work close with the Alberta, the Office of the Child and Youth Advocate, in one case that seemed like one case, but it's actually a systemic case of people aging, or children aging out of care in Alberta, and how unprotected they are when they reach the age of 18. I think it was 21 before, and then it was rolled back to 18. So 18, and they get out of care and no protection, nothing for them. So we go from this one case that is difficult to a systemic case, and so things happening with prisons, and it's happening with home care and seniors facilities. And I think the note says that we are not ready to vote to recruit for this area, but we have done some calls to bring people in to do some research in some of those areas. So you might find that there might be some calls around doing some research, and it's basically how do we build this case as a systemic thing. Yes, that's it. Okay, and so in observation and witnessing is the other thing that we do with Stride Advocacy. And usually how it looks is like, as I was saying, is it's really difficult to go through either a human rights complaint or a court case where there's a lot of onus on the victim of, and there's the expectation that you prove that you have been discriminated against. And that's the way that the human rights complaint system is built. You have to prove that you were discriminated against. And so the case is difficult, and it's not required to have a lawyer, but as Ivana said, just writing the complaint can be re-traumatizing. Just facing the facts again and having to write it in a not involving your feelings, it can be really difficult. So we are there to support, but the process goes beyond that. Sometimes people are called to mediation, sometimes they're called to go to a tribunal. And so being present with people there at the court, in the court, or during the mediation process, even if you're not even if you are not the center or you are not right by them, being there for them, knowing that they can take a break, that the people can ask for to take a break and bounce ideas with you, is really, really important for them, because it's a process that is draining, and they need to be that they are not alone. So I know that we have a call for witnessing for December 8th. I guess Ivana is going to make a call soon for some witnessing. So those things happen. Is not as common as receiving individual cases, but we get calls once in a while to support people. And I know that there's another case that is going into mediation soon. And so those are things that are important to keep in mind. And I know Renee said we have a case tomorrow morning, 8:45, which needs people present. Having more people in the space can make the judge pay more attention. So it's, yeah, all these processes are right now online. So we're making sure that people are protected as well, and that we comply with the needs of the time. So it is important, and it's really, really, it shows the relevance of the case for the people as well. It shows like public interest on that, and puts a little bit of pressure on the people who are making decisions.
Okay, so I'm just gonna talk a little bit about the volunteer requirements and the volunteer, I guess, process. So when we have the applications coming, whether it's via email or Volunteer Connect or in person, however we get interested individuals, we send up an email with the advocate assessment. And the reason that we have the advocate assessment is just to kind of get an idea of what the strong suits or the interests of a volunteer advocate are, so they can be matched to, like cases that kind of coincide with that. So thank you for doing that, because it's not lengthy, but it does take some time. So that's why we send out the advocate assessments. We also have a confidentiality agreement. When you send back the advocate assessment, I follow up with more information. So like the confidentiality agreement, because a lot of the cases that we handle are sensitive in nature. So we just want to make sure that we are taking proper steps to protect all of the community members and as well as the advocates. We also have vulnerable sector checks, because a lot of individuals that we deal with as well are vulnerable individuals. For example, when we go out to on street stride, we just want to make sure that we have volunteers who are, have got their checks and are equipped to actually deal or to I guess, what's the word I want to use, to like interact with these individuals. So that's why we do that. And for the vulnerable sector checks, I am able to provide a letter that has that shows proof of volunteer. And then with that letter, you're also able to get the fee for the vulnerable sector check waived. So if I haven't, I know I have sent these letters out to a lot of people actually on this call, and I have gotten the checks back. But if I haven't gotten that letter out to you just yet, please just send me an email and I'll do that right away. And then we ask that volunteers participate in the STRIDE training. So with the email I send out a lot of training. So we have appreciative listening, and just I send you basically the link to the JC Facebook page, so you can actually take a look at what it is that we have there. And I think it's really important when we're dealing with individuals to show kind of like active listening, appreciative listening, and all of those skills that are necessary in sensitive cases, and just interaction in general, just interpersonal skills. And also this is the another training that we're doing, and here people have an opportunity to actually ask questions and get clarifications on a lot of things. And we have an opportunity to just kind of like outline the entire process for individuals, because it's always better to kind of like interact face to face like we are over Zoom than actually just like reading something off of the website. Yeah. And yeah, so the contribution or the time commitment to the cases is usually an average of 2 to 4 hours per week. When you do have, when volunteers have all of the, I guess, requirements in, so confidentiality agreement, the vulnerable sector checks, and the trainings as well, the case manager actually looks at that, and when cases are available, assigns 2 volunteers to certain cases. And what we found is that volunteers spend an average of, when assigned to a case, an average of 2 to 4 hours a week for contribution. So a week, I should just say. And also I do want to mention that I have gotten questions from individuals about like our, how they track how hours are tracked. And what I usually just say is, if volunteers want to track their hours, that's fine. I'm willing to provide like a letter that shows like proof of volunteer or sign off on your hours, but I just ask that volunteers track their hours on their own, and also include all the trainings while tracking their hours as well, just so we have an accurate idea of how much hours like a volunteer has spent, I guess. Yeah, so that's the volunteer requirements. I don't know if there's anything that I missed. I'm just
Ivana,
I just wanted to mention, now that you're talking about the hours and everything, we are going to be sending out surveys after you're done supporting with a case. And part of the survey is, first, just keep an eye out for anything that isn't working or you'd like to do differently. But very importantly as well, we ask for how many hours a week you've been spending on the case while you've been on the case. So that kind of helps us have an idea more or less how much time our advocates are spending on cases. But definitely, like Adara said, if you specifically want to track your hours, then just track them yourself.
And I guess one last thing that I want to mention is that obviously those are the basic volunteer requirements, but if at any time you commit to doing something and your situation changes for whatever reason, please let us know, because we're counting on people to do things, and we manage a load of around, I want to say like 100 cases. And so we want to make sure, just like through Stride advocacy only. So we want to make sure that we trust that you are moving forward and you're doing it, even though we're following up. But if you say, I'm going to go out with Street Stride, and you said you're going to go for the whole morning and something happened, just let us know and help us figure out how to change the plan so we are not left hanging with whatever you said you were going to do. But we trust you, and most of the time everything is run smoothly, but just a word of caution there of what the expectation is that we have.
Yeah, and like prior to so for Street Stride, and I guess prior to like a first shift, so whether it's with a pantry or with Street Stride, I usually send up a lot of follow-up information, and also kind of like an emergency number that you can contact me on, or if you're going out with Street Stride with Judy, who's a community organizer, I'll send that as well. And like, yeah, I just want to kind of like encourage you to feel free to like send me emails if you have any questions. Like, I've just send me all the emails because that's what I'm there for. So yeah, so that's kind of all I've got to say on about the requirements.
Can I just build on that a little bit? Just as a case manager, a lot of the times I'll send out emails a lot to a big group of people, and sometimes people can't support, and that's perfectly fine. Don't feel pressured to respond if you can't support, because I definitely sometimes I can't respond back if you say no, I can't support. That's okay. If you can't support, then just don't respond to my particular emails for case managers, because we're sending them out to large groups of people. So only if you can support. And something else to keep in mind is a lot of the time cases can be unpredictable, and we don't really know until we do the intake exactly how much it's going to require. So just something to keep in mind as well. Yeah, in terms of how many hours a week we're working. It just really depended on the case.
Thank you.
Thank you, Ivana. Okay, so I have got, I just wanted to give a little bit of like more, I've got someone here who has actually gone out of Street Stride patrols, and I just wanted them to be able to share a little bit of their experience while they're here, so we can all kind of like hear from like a volunteer. So Alexa, if you're here, let me just check. I believe, let's see. Yeah, Alexa's here. So Alexa, could you just share in a couple of minutes your experience with Street Stride over the past few weeks?
Oh, actually, I'm sorry there was any confusion, but I actually haven't gone yet because Judy canceled last Monday.
Oh, okay. Okay, that's fine. Let's see. Okay, so I think I just wanted somebody to talk a little bit about Street Stride. I guess we can do that some other time. I could send that in form of an email. But I do find that it's always kind of nice to have personal stories. But I would say that I've heard very positive things from Judy and from the volunteers who have gone out for Street Stride. So yeah, I just kind of wanted to to share that with the team here. But if there's no one who has done that here, then that's okay. Thank you, Alexa.
Yeah, that's fine. And I think we have around 20 more minutes. If there are any questions, or if Renee wants to share anything else that is left out, we have tried to incorporate the experiences of a Stride throughout. If you have a specific questions about a program that you want to hear more about, then feel free to do it. And we will be able to address them in the next couple minutes or few minutes. We still have a few minutes here. And you feel free to either unmute yourself or type in the chat, and we'll be okay. If missed this information, but how often do you receive cases? Ooh, we receive cases all the time. Like we're getting, I think that at least one case daily, I want to say. Sometimes because as you saw, like there are cases that come through the Facebook page. So whenever, yeah, then a Facebook page, like it's moving the whole time. There is always requests for basic needs. And at this point in time, when we're going back into a semi-lockdown and the needs of people are increasing and the programs are changing in the government, people are having a lot of needs. So if we're talking about the Facebook page, that's like constant moving. If we're talking about Stride advocacy, then we receive cases, I think I want to say 4 cases in a week. It's kind of like the average. And if we're talking about Street Stride, the hours of patrol are set. So yeah, that's kind of like the long answer to that question. So the last case that was posted got taken up pretty fast. Yeah, in the Facebook page is fast paced.
I think that's just a quick distinction there too, is like with the Stride advocacy, there's kind of 2 pieces. There's a poverty angle where it's really from that YEG page. So it's really like connecting people to the right food resources or income supports. Like it's very fast moving in terms of like, it's really focused on poverty. And there's a group of us that it's new for us, whereas the Stride advocacy is a little bit, maybe less cases coming in at a time. So we're regular cases coming in, but I just wanted to make that distinction between the poverty and human rights cases, because since COVID COVID began, Stride has just taken off. Like, so the level of volunteer infrastructure development we've had to do in the past 9 months, let alone be responding to all these needs in community, has been so intense. So it's like we're moving and evolving as we're going, in many ways. So but the numbers are increasing daily, and yeah.
So yeah, if any of you want more information about that support in witnessing tomorrow morning that Renee mentioned at 8:45, please email Renee directly. She's renee@jhc.ca, and she will give you the information.
Yeah, I've got.
Perfect. So I know there are some takers. Yeah, woohoo! I like that.
I prefer actually if you just posted it in there privately to me right now, so I'm not having to deal with more email in my inbox. I'd prefer to just do it now. So that would be the best, and then I'm just getting it out to you right now. So just privately. Awesome.
Okay. Any other questions? So I can talk a little bit about Social Stride. So Social Stride is one of those new initiatives of Stride that came out of, in one of these meetings, we got a volunteer saying, well, actually, I have noticed that people are venting a lot online, and what do we do with that? And so, yes, the online spaces have become spaces but people just, when they feel that they're discriminated against, they just come out and tell us and share with the world. And in many cases, in many situations, those cases go either undocumented or unreported because people find that that's all they can do in social media. So Street Stride is bill to address, yes, those hate and misinformation cases that happen online, but also directing people, sorry, social stride, yes, social stride, are directed to attend the needs of people who are actually also venting online and needing those resources on, like, okay, so this happened to me in the healthcare system, or this happened to me on a store, in a store, what, and so we can direct people when they're having and venting in those spaces. We're finishing training the core group at the end of December, and hopefully we're gonna have like a good recruitment campaign mid-January. And again, that's gonna be a volunteer position where there's gonna be like chiefs for checking online and be responding, and there's gonna be some training involved as well, because it's a difficult space to manage. So that's something that is coming up, and that we'll keep you posted. Any other questions? Things that you want to share?
I think I have one. I would say for people like us in Calgary, like, other than social stride, how else can we contribute? Like,
so we receive cases from throughout the province. So we receive cases in Calgary from Lethbridge. So we have stride teams in cities like Calgary and in cities like Lethbridge. So we do meetings per city to kind of understand what's happening, but we also receive cases from those specific cities. However, right now our volunteer system, because everything is done, most of the things are done at a distance, straight online, then we can we make a call. If we receive a case, let's say there is a case about the welfare system. So usually Ivana or another case manager makes a call, and then people all over the province, they respond. And even we're getting volunteers from outside Alberta who want to support as well. So they respond and say, I'm available to do an intake with that person and follow up on the case. So actually at this point in time, location is not such a limitation for us other than for Street Stride. And the pantry and the pantry response, which is like the only physical things that we're doing. The rest of the advocacy is done online or on the phone, and that's why MightyCall is really important. It's an application that you install on the phone, and you can call nationally without any long distance charges, and also protecting your own private number. So yes, cases and case support can be done throughout the province.
Yeah, and I just want to mention, because I see a comment here about Street Stride. So like I mentioned, that is a weekly thing, but we are on hold right now. Like the Street Stride initiative is on hold right now for a couple of weeks because of the restrictions, the new restrictions. So whenever we are able to go back out, I would connect with individuals and let them know. If you didn't apply directly for Street Stride though, could you please send me an email so that I can kind of just like loop you in with all the updates for Street Stride? Yeah, my email's in the chat.
Any other questions or comments? Oh, sorry, my dog's gonna bark. I'm gonna mute myself. Okay. So I guess anyone else from the team wants to add anything? Are we missing? No? Okay, now we have a question. How do we get assigned to one of the 4 areas? Dara, go ahead.
Okay, so on the Volunteer Connect page, there are, if you apply through Volunteer Connect, there are various active postings. So like there's posting for the pantry, there's postings for the Facebook group moderation, there's the general Stride advocacy posting for community advocates. And like we mentioned, social stride, we are just kind of, we're not quite ready for volunteers. When we are, the posting will be up on the Volunteer Connect page as well, and we'll send out a general email to our volunteer network. So typically individuals would apply through Volunteer Connect or send an email, maybe through like the JXC website, stating what positions it is that they are interested in. However, if you apply for one position and you also interested in another, say if you apply to be a community advocate and you want to volunteer at like the food pantry, for example, that's fine. All you have to do is send me an email stating that interest, and then I'll loop you in. So it's really just boils down to just like letting me know, just communicating with me.
Mm-hmm. Awesome.
I don't know if anyone's interested. I can share a little bit about just like what you might expect doing some street outreach work, because we haven't been able to hear from Judy and a bit about Street Stride, which is a really important aspect of the work. But you know, once it is up and running, everyone will be receiving and information, and also you know, be talking about like COVID and best practices and having masks and PPE available to you. I think that's important for people to know, because it is one of those parts of the work that is sort of out and meeting and interacting with folks. And but generally, yeah, you'll kind of meet as a team. Judy or whoever is orienting will sort of just get everyone together with the supplies, and you'll be out in the elements, which is another thing to consider in the winter time where there is such a great need. Make sure that you're dressing really well, and you're going to be out and walking and meeting people and smiling and saying hi, and handing out food and just sort of connecting and witnessing and hearing what the needs are. And that's sort of, you know, a regular route that they do. And I think that's a really important piece of the work that Stride is doing, and definitely requires different kinds of skill sets, which I think is a really great aspect of these 4 different branches or ways that you can involve yourself as a volunteer with Stride, because there's so many different aspects to the work. So for those who really want to engage with the public, that's a really great way. Requires a lot of heart.
Thank you, Megan. Yes. Okay, so I think we've come to the end, and so what is left, it's contacting with Dara, making sure that you've put your assessment and your vulnerable sector check in, and then we'll take it from there. Thank you for attending the orientation, and thank you for offering your time, and we will look forward to working with all of you. Bye, everyone.